complete uterine cervical septum, which divides the uterine cavity into two small tubular structures. A rare congenital anomaly that is responsible for recurrent pregnancy loss, reproductive failure, and infertility. Hysteroscopic solution is the standard accepted treatment now. It requires skills, knowledge, orientation. So in this video, we will share together the technique of using the scissors to cut and release the uterine septum. Stay tuned, watch, and more tips and tricks to master intrauterine surgery. I'm sure that all my audience have noticed the technique of using the scissor to push and cut. Again, let me explain to you what does it mean, push and cut. When you open the blades and push on the tissues, you exert some stretching and tension on the tissues. So when you close the blades, it cuts perfectly and in the proper plane. Again, if you use the blade to cut directly, okay, the cutting might not be sharp enough and the tissues might not retract. So open the blade, push on the tissues, but it should be a gentle push, not too much push, otherwise you perforate, okay? Just this pushing by the open blades allow to exert tension on the fibers of the septum, so when you close the blades, it cuts more perfectly. This septum is very vascular, against what used to be understood in the past. Earlier, they thought that the septum is fibrous tissue and predominantly non-vascular. However, in more recent research and publication we published 2015, taking a biopsy from the septum, it is very muscular, some little fibrous tissue, and also is very vascular. Okay, so when you face some bleeding during cutting, this is because the intrauterine fluid pressure is not enough to tamponate the bleeder. And the presence of the scissor in the operative channel occupy the shaft of the sheath, which is also the same shaft for the fluid inflow. So when you pull the scissors back, you allow full inflow through the channel and proper distension. When you insert the scissor in, it will occupy the shaft and take part of the surface area which allow the fluid. So keep on pulling and pushing the scissor in and out to give a chance for the fluid pressure to maintain good view. Move from side to side, rotate to look at the corneas, and always remember that the tubal ostium is your GPS point. So every now and then you find me rotating the lens to look at the tubal ostium to check my position and keep on the same line. The objective of surgery is to finish when both tubal ostia are at the same level, at the same line. There is no need for concomitant laparoscopy. It wouldn't help at all. It depends on your visual judgment on the fundus and equal level of both tubal ostia. Every now and then, pull back, enjoy your job. You can obviously appreciate how much surface area is added after release of the septum. Look at the pink part of the uterus, which was the original corneas, and look at the white new surface area. Oh, this is a new surface area added to the cavity of the uterus. So septum is just cut and released. It is not excised. Enjoy the beautiful final view. At the end, you check the tubal ostium and you might add little cut on the left or on the right, okay? Like the hairdressers adjusting the haircut, okay? And using the scissor to move from one side to other side to keep a steady line, straight line from one tubal ostia to the other tubal ostia. So, my dear friends, I'm really glad to share with you the surgical steps, minute by minute. And I want everyone watching my videos to move your hands and your fingers. Imagine that you're holding the scissors. Yes, now. Don't be hesitant. Grab the scissor in your hand and close and open. Rotate your wrist joint. Imagine that you are the surgeon. My dear friends, I hope that these videos and these teachings will help you to master the technique. And this is the post-operative results before surgery and after surgery complete reconstruction. Dear friends, this is Osama Shawki from Cairo, Egypt, and thank you very much.